Most people believe that the more health tests you take, the safer you'll be, especially after turning 70. Every year, millions of seniors line up for screenings that are supposed to protect them. But what if I told you that some of these routine checkups could quietly do more harm than good? Behind the reassuring tone of early detection lies a surprising truth that few doctors ever mention. Recent studies show that up to one-third of all medical tests in older adults lead to unnecessary follow-ups, risky treatments, or lifelong side effects. Even more concerning, almost everyone over 70 is being overdosed without realizing it. Now, here's the part that shocks most people. One of the most common medical scans actually accounts for about 5% of all cancer cases in the U.S. That's roughly the same cancer risk linked to drinking alcohol every day. Yet it's still being offered as a preventive checkup. You won't hear this from your local clinic or see it in health ads, but the data is out there, buried in medical journals and research papers that rarely make the headlines. And today, we're bringing those facts to light. In this series, we'll break down 5 medical checkups you might want to avoid after 70, and more importantly, we'll explain why they may not be as harmless as they seem. From bone scans that spark unnecessary medication to full-body scans that quietly increase your cancer risk, each of these tests hides a story the average patient never hears. Now, before we dive in, we'd love to hear from you in the comments below. Where are you watching from? How old are you? Have you ever regretted taking a medical test that turned out to be unnecessary? Your stories could help someone else make a wiser health choice. And remember, this isn't about fear. It's about being informed. Medicine has made amazing progress, but more testing doesn't always mean better health. In some cases, it means more anxiety, more side effects, and more time spent recovering from procedures that might not have been needed at all. So, grab a cup of tea, get comfortable, and let's explore the truth that could help you live longer, healthier, and more confidently, without falling into the trap of medical overdosing. Because the first checkup on our list might surprise you. It's short, painless, and sounds perfectly safe. But for many seniors, it can quietly cause more fear, and even physical harm, than it prevents. Backhand index pointing right rehook. In the next part, we'll reveal why a simple scan meant to protect your bones can actually trigger unnecessary medication, painful side effects, and loss of mobility. Stay tuned, you don't want to miss this one. Let's start with one of the most common tests given to older adults, the bone density scan, also known as the DEXA scan. It sounds simple enough, a quick, painless procedure that measures how strong your bones are. No needles, no surgery, no recovery time. Sounds great, right? But here's the part that doesn't get talked about. Once you're past 70, this test often creates more fear than benefit. The reason? It almost always shows some degree of bone loss, even in perfectly healthy people. That's because losing bone density with age is as natural as getting wrinkles or gray hair, it happens to everyone. The scan itself isn't dangerous, but what happens next can be. Many seniors get told they have osteopenia, or mild bone thinning, and that's when doctors often prescribe strong medications called bisphosphonates. These drugs are designed to strengthen bones, but they can also lead to serious side effects like jawbone damage, severe heartburn, or inflammation in the esophagus. And here's the kicker, scientific research shows that in people over 70, these medications barely reduce fracture risk at all. One major study followed over 1,200 women for 5 years and found that the drugs reduced bone fractures by less than 1%. In other words, they made almost no real difference, yet exposed patients to months or even years of unpleasant side effects. Take the story of Rose, a 76-year-old retired piano teacher. She was strong, active, and never had a fall. Her doctor ordered a DEXA scan during a routine visit, and the results showed mild bone thinning. She was prescribed medication, just in case. Within a few months, she developed reflux so painful she stopped playing piano altogether. When she was taken off the drug and started on vitamin D, calcium-rich foods, and light-resistance exercises, her strength and balance improved naturally, no medication needed. The truth is, if you haven't had falls or fractures, you might not need the scan at all. A healthy lifestyle, including strength training, balance exercises, sunshine for vitamin D, and calcium from real food, can cut your fracture risk by more than 20%. Sometimes, the best treatment is simply movement and nourishment. Don't let a scary scan number push you toward unnecessary medication. Backhand index pointing right rehook. But what if the next test doesn't affect your bones, it affects your mind? In the next part, we'll uncover the truth about brain MRIs for memory loss, and why these scans can sometimes lead to panic, misdiagnosis, and even unnecessary surgery. Forgetting a name, misplacing your glasses, or walking into a room and wondering why you're there, it happens to everyone. But for seniors, those moments often trigger a wave of anxiety. Is this dementia? Could it be Alzheimer's? And that's when many doctors order a brain MRI. At first, this might sound like a smart idea. An MRI provides a detailed image of the brain and is often used to look for tumors or other structural issues. But here's the uncomfortable truth: in most older adults, the scan doesn't reveal anything meaningful. In fact, what it does show are changes that are perfectly normal with age, a little shrinkage, some white spots, and minor irregularities that almost everyone develops by their 70s. The problem? Once those abnormalities appear on the report, they often set off a domino effect: more tests, more fear, and sometimes even unnecessary surgery. A 2021 study reviewed over 3,000 brain MRIs in adults aged 70 to 85 who had mild memory complaints. The results were eye-opening. About 86% of those scans showed some kind of abnormal finding, but only 3% were linked to a treatable condition. That means most people walked away thinking something was wrong, when in reality, nothing dangerous was happening at all. And the emotional cost can be huge. Take George, a 74-year-old retired engineer who came in worried that he was becoming forgetful. His doctor ordered an MRI, which showed minor white matter changes, something completely normal for his age. But once he heard the word abnormal, his confidence collapsed. He stopped driving, withdrew from social activities, and his anxiety skyrocketed. Months later, after a full cognitive test, George was told his memory was completely fine. The MRI hadn't helped, it had actually made things worse. Unless a person has serious neurological symptoms, like seizures, sudden behavioral changes, or rapid cognitive decline, a brain MRI rarely provides useful answers for mild forgetfulness. Instead, a simple cognitive screening test, which involves short memory and problem-solving exercises, is far more effective and affordable. So before rushing into a scan, ask yourself, what will I do with the result? If it's just going to cause more confusion or fear, it might not be worth it. Sometimes reassurance, lifestyle changes, and mental stimulation, like puzzles, reading, and social connection, can be more powerful than any machine. Backhand index pointing right rehook. The next test on our list is even more common, and it's performed on millions of older adults every year. It's meant to protect your heart, but for many, it ends up sending them to the hospital instead. Stay tuned, because next, we're exposing the hidden risks of the cardiac stress test. For decades, the cardiac stress test has been one of the most common heart screenings for older adults. If you've ever complained about feeling tired, winded, or just off, your doctor may have recommended one. On paper, it sounds perfectly logical. The test measures how your heart performs under stress, usually by walking on a treadmill or through medication that simulates exercise. But here's the problem no one talks about: after age 70, this test can do more harm than good, especially for people who don't have clear symptoms of heart disease. The reason lies in accuracy, or rather, the lack of it. In seniors, stress tests can be misleading. Age-related changes in the heart and blood vessels often create results that look abnormal even when everything is fine. In fact, studies show that in people over 70, the false positive rate can be as high as 40%. That means nearly half of those who take the test may be told there's a heart problem when there isn't one. And what happens next? More invasive tests, like angiograms or catheterizations, and in some cases, unnecessary stent placements or even bypass surgery. A major study published in JAMA Cardiology revealed that more than half of the stents placed after stress tests were done in patients who had no symptoms and gained no improvement in survival or quality of life. What they did experience were complications, bleeding, kidney injury from contrast dye, and long hospital stays that left them weaker than before. Take Raymond, a 75-year-old retired mail carrier. He stayed active, walked daily, and had no history of heart disease. During a routine visit, he mentioned mild fatigue on steep hills. His doctor ordered a stress test, just to be safe. The results came back suspicious, and he was sent for a catheterization. They found a minor narrowing in one artery, nothing dangerous, but a stent was placed anyway. That night, Raymond developed a reaction to the dye and suffered kidney complications. He spent 6 days in the hospital, and ironically, his fatigue never changed. It wasn't his heart, it was simple dehydration and overexertion. For most people over 70, if you're not experiencing chest pain during activity, shortness of breath, or major fatigue that limits your daily life, a stress test probably isn't necessary. Safer alternatives include a resting EKG or a coronary calcium scan, which provide useful insights without the same risks. Sometimes the heart just needs care, not constant testing. Backhand index pointing right rehook, but what about the test that everyone dreads, the one doctors say could save your life? In the next part, we'll expose the shocking truth about colonoscopy screenings after 70, and why this routine procedure may be riskier than anyone admits. Now let's talk about one of the most dreaded tests of all, the colonoscopy. Doctors often say it's essential for cancer prevention, and for many adults, that's true. But once you pass 70, the balance between benefit and risk starts to shift in a big way. A colonoscopy involves clearing out your digestive system with strong laxatives, then inserting a camera to check for polyps or cancer. While that might sound simple, the prep and sedation can be surprisingly harsh on older adults. Dehydration, dizziness, kidney strain, and confusion from anesthesia are all common side effects. And the procedure itself isn't without danger, it can cause internal bleeding, tearing, or irregular heart rhythms during sedation. A large 2019 study following over 1 million Medicare patients found that for every 1,000 colonoscopies performed on people over 75, only 2 lives were saved, but more than 20 people suffered serious complications. That's a 10-to-1 risk-to-benefit ratio. Take Dana, a 73-year-old bakery owner. She was healthy, symptom-free, and had already had 2 clean colonoscopies. Her new doctor encouraged her to do another, just to be safe. During the procedure, a tiny polyp was removed, but that night she collapsed from a bowel perforation. After 9 painful days in the hospital, she left weaker and more anxious than before. For Dana, that routine test wasn't life-saving, it was life-altering. Health experts now agree that routine colonoscopies past 75 are rarely necessary unless you have symptoms like bleeding or unexplained weight loss. For most older adults, a non-invasive stool test like the FIT test, done easily at home, is a safer way to check for early signs of cancer. But if you think colonoscopy risks are high, wait until you hear about this next one. Some private clinics now promote full-body CT scans as ultimate health checkups for seniors. They claim to detect hidden cancers before symptoms appear. But here's the reality, these scans expose you to massive doses of radiation, the equivalent of up to 500 chest X-rays. A 2023 study found that about 5% of all U.S. cancers may actually stem from overuse of CT scans. And what do these scans often find? Tiny harmless nodules that lead to more scans, biopsies, panic, and sometimes unnecessary surgeries. Many radiology experts now strongly discourage full-body scans in healthy people. The real secret to longevity isn't found in more tests, it's in smarter choices, staying active, eating well, managing stress, and knowing when to say no to unnecessary procedures. Backhand index pointing right rehook /outro. So, which of these checkups surprised you the most? Have you or someone you love faced complications from an unnecessary test? Share your story in the comments, we read every one. And remember, prevention doesn't always mean testing. Sometimes the best medicine is simply living well and trusting your body's wisdom. If you've made it this far, congratulations, you've done something many people never do, you've looked beyond the headlines and asked why. By now, you've seen that not every test labeled routine is truly necessary. Medicine is powerful, but it isn't perfect. Sometimes what starts as prevention ends up creating anxiety, overtreatment, and stress that quietly erodes quality of life. So, what's the takeaway? It's not about refusing all checkups, it's about making informed choices. After 70, the goal isn't just to live longer, but to live better. That means focusing on function, energy, independence, and joy rather than chasing numbers on a report. Let's reframe what health really means at this stage of life. Health isn't a stack of lab results. It's waking up without fear. It's walking your dog, laughing with friends, cooking a meal you love. It's trusting that your body, while older, still has incredible resilience when supported with movement, nutrition, and good sleep. Here's what doctors who specialize in longevity now emphasize: listen to your body. Subtle signals, changes in appetite, sleep, or energy, often tell more than a random scan. Prioritize lifestyle medicine. Regular strength training, balance exercises, hydration, and whole foods often outperform pills in protecting bones, heart, and brain. Ask better questions. Before any test, ask, what will we do if the result is abnormal? Will it actually change my treatment or just create worry? Choose continuity over quantity. A trusted primary care doctor who knows your history can help you skip unnecessary procedures and focus on what truly matters. Think of modern healthcare like a toolbox. Not every situation requires a power drill. Sometimes, gentle maintenance keeps the whole system stronger. And above all, remember this: you've earned the right to peace of mind. You don't need to chase every test to prove you're healthy. You just need to live in a way that keeps your spirit alive and your body supported. So next time a clinic advertises a senior screening package, take a breath. Ask questions. Do your research. Then decide from a place of calm, not fear. That's real prevention, and real empowerment. Backhand index pointing right final rehook/outro, because in the end, staying well after 70 isn't about how many scans you've taken, it's about how deeply you live each day. If you found this series eye-opening, hit like, share it with someone who needs reassurance, and drop a comment about the healthiest change you've made this year. Let's keep spreading clarity, not fear.